Symptoms are swamping Oklahoma hospitals right now. In fact, just about every state across the country is seeing a widespread flu outbreak right now. It doesn't help that this year's flu shot is reported to be just 30% effective. 2 Works for You reporter Micah Hatfield shows us how Oklahoma is faring this season.
Last flu season, the health department's records show the flu peaked in mid-February. This year, it's hit a high point in mid-December. They say it's too early to tell if that's the highest it'll be.
It's too early to tell if this year is particularly worse than last year, but what we are seeing is a lot of hospitalizations and even deaths within the state of Oklahoma.
In Tulsa County, 225 people have been hospitalized for the flu since September, 22 people dying statewide. But school districts in the area say they aren't seeing a big impact.
We haven't seen a lot so far. I think district-wide we're only at 2% of kiddos reporting that they're out sick.
Both Tulsa and Sand Springs public schools saying they're actually seeing an increase in attendance by 1% or 2% right now versus this time last year. Schools are staying proactive to keep the germs out of their classrooms.
We provide the Clorox wipes for our teachers, hand sanitizer, the parents send that. A lot of kiddos have the little ones on their backpacks and things, and then we have the signs to remind them to wash their hands.
Fever, chills, body aches, coughing, runny nose, nothing that anyone wants. But getting sick is easy. The germs are just droplets floating in the air. And being indoors in close quarters, like work or school, just increases your risk.
However, if you are sick, you need to stay home. If your child is sick, you need to keep them home from school. They should be fever-free for 24 hours without the aid of fever-reducing medication before they're sent back to school.
I'm going to be carrying around this Germ-X, using it as much as possible to hopefully stay germ-free. The health department says it is important to take those kind of precautions. In Sand Springs, Micah Hatfield, 2 Works for You.
Now, in certain parts of the country, pharmacies are even reporting a shortage of the liquid form of Tamiflu, what's typically prescribed for children. But the CDC says there should be enough to meet the demand this flu season.